All right, welcome everyone. We are going to provide some time for everyone to get into the room. We are very happy that you are here, excited to be able to present this information with you, as well as listen and learn from our speakers. And so we will provide a few minutes for folks to come into the room. And while you're coming into the room, feel free to introduce yourself in the chat if you'd like. Sharing your name, your organization, where you're calling in from, preferred gender pronouns if you have any. I'm John. I'll provide more of a introduction to myself in a little bit, but I am calling in from Oakland. And yes, I will go ahead and change my name so that we can be clear about who I am. Welcome, Justin. Calling from Atlanta or calling in from Atlanta. Welcome, Ernalyn, Rox, Angela. So Erlen's calling in from Apple Valley, California. Rox is here in the Bay Area. Angela's calling in from San Francisco. Hey, Vanessa, calling in from Concord, California. We're going to give another minute or two. We had many registrants, so I think people are coming in. Hi, Heidi from Seattle. Good morning. Good morning, Monica, who's calling in from Honolulu. Is it Anna from Seattle? Welcome. Hi, Ben, calling from Los Angeles. Or actually in San Diego. I think you're in San Diego, right, Ben? Good morning, Lisa from Honolulu. I feel like this is kind of like an old school radio show right now. I appreciate it. I always wanted to be a radio show host. All right, I'm gonna give one more minute and then we're gonna go ahead and start. Welcome, Anna from New Mexico. Hey, Julia, calling in from Chicago. All right, I'm going to go ahead and start. Please continue to introduce yourself if you haven't in the chat so that folks know where you're calling in from. I'm glad that we're having people from all over the country here. Welcome to our webinar, How Health Centers Can Support Asian American Students Returning to School During COVID-19. We are your moderators today. Tiffany, would you like to introduce yourself?
Yeah, sure. Hi, everyone. My name is Tiffany Hirokawa. I use pronouns she, her, hers, and I'm the infectious diseases intern at AAPCHO this summer. Happy to have you all here.
Okay, great. Thank you, Tiffany. I'm John Winyap. I'm the Associate Director of Health Equity Associate for AAPCHO. I'm calling in from Oakland, as I mentioned. My pronouns are he, him, and his. I just want to shout out Tiffany, who is one of our summer interns, who has really fully taken on the lead for this webinar. This has her vision. She is a student, so she is experiencing this. She can tell you more about her story, but I really want to appreciate her for the leadership that she's given for this webinar. So thank you, Tiffany. All right, just in case you need the photo options, they're in your invite in the email, but also here's the information that Tiffany is going to put in the chat. Also, just as a reminder, for folks, if you have questions along the way, please post them in the Q&A box, and then Tiffany, myself, some of our other AAPCHO staff will be looking at the Q&A just to make sure your questions are addressed. If we can, we have very limited time as well too. All right, so for the overview for today, this is what we're gonna go over this webinar. You'll get a really brief introduction to AAPCHO if you're new to us. And then Tiffany's gonna discuss trauma-informed approaches at community health centers. Then we have our wonderful speakers. First speakers will be coming from the Stop API Hate Youth Campaign panel, staff including a youth intern as well. And then also afterwards, we're gonna have a presentation from Bay Area Community Health talking about the ARISE program, a wonderful program here in the Bay Area. And then we're gonna share numerous resources. If you know AAPCHO, we love resources and sharing them, and we'll close. So this is a very tight hour, but we are looking forward to hearing from you and also from our panelists. So if you're unfamiliar, really quickly, AAPCHO is the Association of Asian Pacific Community Health Organizations, and we're dedicated to promoting advocacy, collaboration, and leadership that improves the health status and access of Asian Americans, Native Hawaiians, and Pacific Islanders within the United States, the US territories, and the freely associated states. AAPCHO, we were founded in 1987, and we are a national association of 32 community health organizations that includes health centers, primary care associations, and community-based organizations that collectively represent nearly 3/4 of a million Asian American and Native Hawaiian / Pacific Islander patients across the country. And Bay Area Community Health is one of our member organizations. We are also a Bureau of Primary Healthcare funded National Health Center Training and Technical Assistance Partner, where we provide free training and technical assistance to all health centers. Now, I would like to welcome Tiffany to dive into this very timely and important webinar.
Thank you, John, for that introduction and for sharing more information about AAPCHO. So now we will go ahead and go into our learning objectives. So by the end of the webinar, we aim to identify best practices for integrating trauma-informed care into community health centers, understand the diverse mental health needs of Asian and Asian American youth during the start of the school year and the continuing pandemic, and finally, inform students and families on appropriate mental health resources and culturally informed community support networks. So first, I would like to start off with trauma-informed care during COVID-19. So as we can all see, with the ongoing pandemic and persisting anti-Asian sentiment, especially in online spaces, Asian and Asian American youth and young adults are re-entering spaces without the protection of the screen. With anxiety stemming from multiple sources like racism, COVID-19 infection, resocialization, and many others, we want to ensure that our students, especially from middle school to college age, and speaking as someone who's at the university level myself, have the support necessary to enter these in-person spaces while continuing to face adversity. And furthermore, as we're very well aware, COVID-19 has disrupted daily life as we know it, introducing trauma in varying degrees. With the continued traumas of the COVID-19 pandemic and ongoing anxieties, today we will focus on trauma-informed care as a means for supporting our youth and young adults, mental health specifically. With primary care facilities and community health centers being the first point of contact for many of our youth and young adults, you are at the front line of intervention. Therefore, we aim to provide you all with best practices for implementing trauma-informed care at the community health level in specific. So first, I would just like to give a brief introduction to what trauma is. So in order to understand these best practices, we must first understand what is trauma. So SAMHSA defines trauma as resulting from an event, series of events, or a set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. And finally, I would just like to look at the effects in this part is that the effect as we see of the event on an individual may occur immediately or have a delayed onset. Therefore, preventative measures and especially early intervention are key to addressing COVID-19's impact on youth and young adults' mental health. Moving on quickly to what exactly is trauma-informed care. SAMHSA defines trauma-informed care as a program, organization, or system that realizes the widespread impact of trauma and understands potential pathways for recovery, recognizes the signs and symptoms of trauma in clients, families, staff, and others involved with the system, and responds by fully integrating knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re-traumatization. With this in mind, we know that trauma and interventions for it are not confined to the behavioral health sector, but many outside of it, including primary care facilities, and peer-run and community-based organizations. So with this, we see that youth and young adults have a wide range of needs that need addressing through trauma-informed care from varying systems, of course. So today, our speakers will unpack multiple avenues for trauma-informed care through anti-racism, peer support, and community services to provide youth and young adults the necessary support they need to return to in-person school amidst the continuing pandemic. So today we will feature speakers from the Stop AAPI Hate Youth Campaign, including Christy Chen, who is the Youth Campaign Manager, and we have Megan Chan, who is also a Youth Campaign Intern, followed by a presentation by Marjorie Huang, the Behavioral Health Manager at Bay Area Community Health. So whenever you're ready to start, Christy and Megan.
Hello, thank you for the introduction. Again, my name is Christy Shen. I use she, her pronouns, and I am the Youth Campaign Manager. Today, I'm joined by Megan. Is your camera on? You want to say hi, Megan?
Hi, everybody. My name is Megan. I'm a rising senior from the LA area. And I actually don't start school till next week, and I'm going back in person. So this is all very relevant to me too.
Thank you, Megan. Yeah, so today we are going to do a little short presentation about breaking the stigma regarding mental health and share some of the preliminary findings we got from our summer 2021 Stop AAPI Hate Youth Campaign. Next slide. Next slide, please. Oh, I think you skipped our land acknowledgement. Yeah. All right, so before we start our presentation, we in ethnic studies like to make land acknowledgements, and a land acknowledgement is a way to pay respects to the indigenous peoples of the land that we are residing on. So this following statement was drafted by our Stop AAPI Hate Youth Campaign interns, I think like last fall. And I want to invite you all to honor our land and the people of the land that we are on as Megan reads this out loud.
The Stop AAPI Hate You campaign recognizes that we reside on stolen land. We would like to acknowledge and pay respects to the indigenous nations of the land that we occupy. We acknowledge and honor the land itself and the elders, past and present, and people in the making that are connected to this land on which we gather.
Thank you, Megan. So we also want to acknowledge that we recognize this acknowledgement is really not enough, and it doesn't undo any of the harm that has been done and continues to be done on Indigenous people and the land. And we acknowledge that Indigenous people are still here, and they will not be erased, nor their history or any of their presence. So I currently reside on Ohlone land, which encompasses a lot of like the San Francisco Bay Area. And I would encourage everyone to visit nativeland.ca to find out whose native land you are on. Next slide. So again, this is our Meet the Team slide. My name is Christy Shen. I use she, her pronouns, and I am the Youth Campaign Program Manager. And I'm joined by Megan.
Hi, everybody. So my name is Megan Chan, and I use she, her pronouns, and very excited to share with you all everything we've done this past summer.
This presentation was also co-created by two other of our lovely interns, Jaden and Stephanie, who have school stuff right now, have like school priorities right now. So they couldn't join us today, but we also want to acknowledge their work and share them in this slide. Next slide. So I am sure you all are aware of the uptick in anti-Asian hate during this COVID-19 pandemic. And Stop AAPI Hate is a coalition created in response to the alarming escalation in xenophobia and bigotry resulting from this pandemic. Next slide. It started as a reporting center launched March 19, 2020, so last year, by the Asian Pacific Planning and Policy Council, APCHO for short, Chinese for Affirmative Action, CAA, and the Asian American Studies Department at San Francisco State University. This reporting center tracks and responds to incidents of hate, violence, harassment, discrimination, shunning, and child bullying against Asian Americans and Pacific Islanders in the United States. Here, I want to emphasize that we will be using the term hate incidents instead of hate crimes, because crimes have this connotation that it is something punishable by law, and that does not encapsulate all of the incidents that our communities have faced these past 18, 19 months. Next slide, please. So today I will be highlighting and emphasizing the Stop AAPI Hate Youth campaign, which is our youth internship program that started last summer. We had about 80 high school interns join us last year, and they created a policy report, which is here on the top left. They blame me because I am Asian, about racism against youth during this COVID-19 time. They also created workshops and online resources. You'll see some of the mental health resources and ethnic studies. These are some of the workshops we hosted in a fall conference. And then this is available in our Google Drive toolkit that I'll be sharing in a bit. The other thing that our students did this last spring was they created a back to school report. It's right here in the middle, titled "I Want to Feel Safe Returning to School." And it shows some findings about how AAPI students feel about returning to in-person learning. And now we're here in the summer that we just finished our summer internship program, where we had a little over 100 high school interns, Megan being one of them. And we did a anonymous survey and some conversations to hear youth stories about how they feel regarding several topics that Megan will be sharing in the following slides. Next slide.
Yes, so this is the first of several graphs that we will be sharing with you all today in our presentation. And this data is from our spring back to school report, in which 103 AAPI students shared their thoughts about returning to in-person learning. Now on the right here, on the right side, we have a graph that asks students their level of concern in regards to returning to school and potentially catching COVID-19. On a scale of 1 through 10, with 1 being not concerned at all and 10 being extremely concerned. And most students chose number 5 or above. On the left side, we have a graph that asks students to rank their concern in returning back to school with the rising anti-Asian hate and/or bullying. As you can see, the majority of students did not choose 1, which means that most AAPI students are concerned about AAPI racism. Next slide, please. So for this summer, we created 3 policy reports related to racism, cyber racism, and mental health. Over 100 youth interns from across the nation came together to research, interview, and record our findings and recommendations to combat anti-AAPI hate and spark conversations on the importance of wellness and mental health. We collected stories from 1,156 AAPI youth and shared them in our summer 2021 policy reports. Now we are still finalizing and polishing these reports, so they have not been published just yet, but the following are our preliminary findings. Next slide, please. So in our anonymous survey of 1,156 respondents, 267 youth shared that they experienced anti-AAPI racism during COVID-19. Now I'm just going to go over a few numbers. Over 2/3 of the incidents involved verbal harassment and name calling, 68.5%. 1 in 3 cases, 33.3%, included avoidance or shunning, the deliberate avoidance of AAPIs. More than 1/4 of youth named online misconduct, 27.0%, as a type of discrimination they had experienced. Being coughed at or spat upon, 9.4%, and physical assaults, 3%, followed as the next categories named. Next slide, please. And so here are a few direct quotes from the youths that were interviewed about the reported incidents. If I could have Tiffany come in and read them for us.
Thank you, Megan. So right now I'm going to go ahead and read some quotes from specific incidences. So for verbal harassment, we have, I went to play basketball at a park and there was a group of kids who started yelling at me. They blamed COVID and the quarantine on me. I was uncomfortable, so I left the park. We have avoidance, in which someone said, I was in the grocery store during early COVID when a woman looked at me and pulled her son farther away from me, saying, you can never be too careful, right? Before walking off. We have physical harassment for someone saying, during the incident, I was at school and I was walking to my second period. At that time, I walked past a group of boys and one of them started to throw binders, papers, and goldfish at me. In addition to throwing of objects, I was also told to go back to China repeatedly.
Yeah, so those were just a few of the many stories that we collected during our anonymous survey. Next slide, please. So another section of the survey was cyber racism. And one key finding that we collected was that almost half of the respondents reported experiencing or witnessing racist incidents online. Now, in this day and age, it's easy to hide behind a computer screen and carry out hateful dialogue and actions because of how accessible everything constantly is. From comments on YouTube, Instagram, or even Twitter, the easy access allows anyone at any time to make a post without having to face real life consequences. Next slide, please. So the last section of our anonymous survey asked about mental health. Now, from the responses, the percentage of AAPI students with excellent mental health decreased over 50% from 10.2% pre-pandemic to 4.8% during the pandemic, while the percentage of AAPI students with poor mental health roughly doubled from 6.4% pre-pandemic to 13.1% during the pandemic. So here is another graph that was part of our survey, and it asked the youths, what have been your greatest sources of stress from the COVID-19 pandemic? From our data, we found that common sources of stress from the pandemic amongst AAPI youth were noted to be mental health issues, impact on family members, physical health concerns, and discrimination towards AAPIs. So 95.7% of AAPI students have mental health services available at school. Only 15.2% of students actually use them. Only 24.8%, less than a fourth, of AAPI youth respondents were satisfied with mental health services available at school. Now, this graph here displays what would make AAPI youth more likely to use mental health services, and the top three were more AAPI counselors, less cultural stigma, and better advertisements or more availability of mental health services. Now, in response to the graph on the previous slide, AAPI youths shared issues about their mental health services at school and why they might not want to utilize this service. I can have Tiffany read these quotes again for me.
Of course. So in our first quote, we see, we have a student body of 300 students and 2 women cannot deal with all of it, especially as they are both white women and our school is very diverse. Their demographics don't reflect our needs. In another quote, we see, just knowing people with the same experiences as me, more people with diverse experiences because of their ethnicity, or having more experiences with other people shunning them because of their differences. Having these communities and being able to connect with people like me, we need more services that help fight against the ignorance that is still present in society today. And for our final quote, we see, personally for me, when I was going through things, I didn't want to go to the counselors. I was like, they won't understand me. I don't know them. It's just like, why would I go to a random adult when I can go to my friend who's Asian that I can relate to more?
Yes, so those are again just some of the many quotes from our interviews. And so the next couple of slides that we'll be sharing are some of the many recommendations that were drawn up by our interns in the summer policy report. We'll go over each one listed on the slide today. Next slide, please. So the first one we have is the implementation of ethnic studies into our education system, which would ensure that all students have the ability and access to learning more about the history of the AAPI community. Now, the history and stories of the AAPI community deserve to be taught and remembered by generations to come. It's the only way to guarantee that our stories and voices are heard. Introducing ethnic studies as a class for students to take will allow them to connect deeper with their heritage, while also ensuring that there's a safe space for them to do so at school. Now, coming from a school that doesn't offer an ethnic studies class, I'd have to personally enroll at my local community college if I wanted to take the course. And even then, we're not always guaranteed a spot in the class. Next slide, please. So those schools themselves are becoming more diverse. Faculty is not. A student surveying participants on the importance of faculty diversity found that 93% of respondents felt that minority professors positively impact the education of minority students, concluding that they benefit academically and socially when exposed to teachers who, quote, look like them, sound like them, and have similar experiences. A diverse faculty allows students to feel more validated in their individual or culture-specific struggles. Now, moreover, trust comes more easily through shared values and belief, so AAPI counselors would make AAPI students more likely to reach out. Next slide, please. Simply discussing our problems and verbalizing our negative emotions with another trusted individual has been shown to reduce stress, strengthen our immune systems, and reduce physical and emotional distress. So with check-in forms, they should be made more approachable for students who struggle to reach out for help. Check-ins do not have to be intense or deep conversations about mental health. Even short interactions allow students to develop a larger belief that there are people who genuinely care for their well-being. So education is necessary to combat the low mental health literacy, or the knowledge and awareness of psychological disorders, their symptoms, and treatment. Workshops should emphasize reconciling unfamiliar Western concepts of mental health with familiar AAPI understandings of psychological distress. It's essential that such educational workshops acknowledge the role culture plays in mental health, making it a more familiar, approachable topic for the AAPIs without advocating for one specific interpretation at the expense of another. The implementation of affinity spaces not only devotes a designated safe space for students to come together in support of one another, but also contributes to the fostering of connections through heritage and culture. Now, our current education systems have not allowed students to fully engage themselves on the history and stories of the AAPI community without essential point of views being left out. Many students may often opt to stay silent and suppress their emotions as a result of not knowing or not wanting to speak out. Holding these safe spaces for students serves as a direct outlet for them to release their emotions. Many students at times may also shy away from having to talk about their own feelings to adults or even the people around them, as it may be difficult to articulate the emotions they are feeling. Affinity spaces can offer more comfort and support for an individual, as they'd be sharing a space with others who share similar experiences. Next slide, please. And yeah, so with that, it brings us to the end of our presentation today. And just again, I would just like to say that these were just some of our many recommendations, and to view more, stay tuned for more stay tuned for our full policy report when it gets published.
Thank you so much for that presentation, Christy and Megan. That was really insightful and really inspiring. So as we're at this moment right now, we're going to go ahead and enter a Q&A portion for about 5 minutes or so. So in the moment, please feel free to answer any of your questions that you might have into the Q&A box, and Christy and Megan will try their best to answer them. But starting first off, if we can go ahead and ask one question. I know someone was thinking, at least for the wellness workshops, I know you were discussing that right now. Are there any particular ideas that the youth came up with regarding what you would focus on in these wellness workshops? Doing so in a way that, you know, reduces the stigma in talking about mental health?
Yeah, we actually have youth created youth-led workshop materials also created this summer. They're being finalized again. So I think these wellness workshops are great because the ones that the youth created, they're youth created for, like they're created by youth for youth. And I think that's very powerful in seeing what they need and they want. Like, I'm not that young anymore, so I can't speak for you all like Megan, but I think consulting your target audience and asking them to step up and maybe like lead something that they really want or really passionate is a great idea.
Oh yeah, just add on a little bit to what Christy said. I know the youth campaign offers a lot of student-led workshops, and a lot of times, personally for me, I feel like that has made a more significant impact in terms of outreach to other students.
Thank you for those responses. I see we have two questions right now that popped into the chat. The first one mentions, so September is Suicide Prevention Month. Are there any plans, at least for the youth campaign, related to suicide prevention? Any activities or programs that you're all thinking of?
Actually, that's a great thing to put on our radar. I have not planned that, but I think maybe we can discuss something. Yeah, I don't have anything planned right now, but we are starting to do fall workshops, or like starting the planning to do fall workshops to connect with schools and connect with students from different schools.
Great. Okay. Well, I'm glad though someone was able to bring that into your radar, at least for now. And so we see a question from Kathy right now, who's asking, are online affinity spaces being used at all?
They are so we offered affinity spaces during the summer and Megan loved it. I'm speaking for her. And one of our interns suggested we continue doing that. So he is probably going to lead some type of virtual affinity space during the school year. And I think that would be that's I don't know, one of those like student-led initiatives, because he feels that he doesn't have very many AAPI students at his school. So he wants to connect to students virtually through these shared experiences. I'm going to bring Megan to talk about her experience with virtual affinity spaces.
Of course. So the youth campaign this summer was all virtual. And so from my end, having a virtual affinity space was amazing because I was cooped up at home all summer. And with our youth campaign, we again had interns zooming in from all over, all across the nation. And so I had the chance to meet and work with people on the East Coast, like Pennsylvania, Arizona, it was all over. And I personally think a lot of the people I've met through the youth campaign, I would definitely keep in contact with. It was just so cool because we were in different time zones, but because of these online affinity spaces, we still got to meet each other, and it was just a really cool thing to be able to connect.
That's great to hear, especially, you know, having your own experience of talking about these affinity spaces. I guess even though we're all kind of Zoom fatigue, at least the benefit of it is we're able to meet people that we otherwise wouldn't be able to meet in person as well. So thank you for answering that right now. And so I know, of course, we are kind of at the end of our Q&A chat, but if there are any other last minute questions, please feel free to enter them into the chat right now. At the end, we may have a little bit more time to cover some Q&A. So if you have any additional ones, we can go ahead and return to them later. But for now, then, I suppose we can go ahead. Oh, let me see. I see there is one other question again from Kathy. Kathy was asking, how can we get involved as an AAPI social worker / clinician with the youth campaign?
We love speakers. I would love for you to share your story with our students. We had a speaker every week come in and talk to our students, just like about your life story and how like you got involved in your activism, in your work. And I think it's so amazing to, like, I spoke and interacted with so many more AAPI social workers or mental health professionals this summer than I think ever in my life. And so expanding that field and exposing our students to this option is one way I think I would love to reach out. I'm going to reach out to you after.
We can go ahead and share the contact information after as well and coordinate you all together. So thank you so much, Christy and Megan. So at this moment, we are going to go ahead and move on to our second speaker right now. So thank you again. Right now, we are going to hear a presentation by Marjorie Huang from Bay Area Community Health, and she will offer on-the-ground examples, many of which were kind of in the recommendations offered by the youth campaign. However, she's going to be speaking through Bach's Arise Wellness Project. So the project focuses on mental health prevention and early intervention services to support not only Asian youth, but also their families and other young adults to address their mental health needs. And so doing so, more importantly, through a culturally understanding lens. So right now, Marjorie, whenever you're ready to go ahead and start.
Thank you, Tiffany, for that introduction. I'm trying to get control of, let me see. Okay. Start, I will talk to you today about our Arise Asian Wellness Project services. So Arise is a UELP program. Our goal is to provide mental health services for historically unserved and underserved East Asian populations here in Alameda County in California. And as many of you are aware, the reason this population is underserved, because it may be because they're new immigrants and they don't know about the resources in the area, or it's because of stigma related to mental health issues. Another reason may be due to the language barrier. So our Arise staff are able to provide culturally sensitive services in our clients' languages. Currently, that's in Mandarin Chinese and Korean. This has helped reduce dropout rates, and clients are more likely to return to services. Our services aim to reduce the stigma and discrimination towards those experiencing mental health issues. And the services we provide are individual prevention counseling, workshops, support groups, outreach, and community events. Our staff are also able to meet clients at their homes or in the community. And this is another thing that helps reduce accessing services such as transportation, and also meeting clients in a safe space. We collaborate with local schools, community-based organizations, churches, and other stakeholders that serve the Asian community. Trying to go to the next slide here. So to be eligible for Arise services, the majority of our participants need to be East Asian, and that includes Chinese, Taiwanese, Korean, Japanese. But the other 25% can be from other ethnic groups. But everyone must live in Alameda County though. And most of our funding, at least 51%, is focused towards youth 25 years or younger. So we also work with adults and elderly. And I believe together, working with the entire family makes, at least for the Asian community, is the best way to provide services. The other great thing about Arise services is that they're free due to being funded through California's Mental Health Services Act. So participants can receive services regardless of their income level, their immigration status, or their insurance status. We also provide other incentives for people to come and join our programs, such as gift cards, free food, giveaways, and promotional items. Next slide. Now I will discuss one of our clients from this last school year who we found was a very successful case. We will call her Grace for purposes of this presentation. So Grace is a 18-year-old newcomer Mandarin speaking student. She was referred by her school counselor due to some family issues and self-harm. One of our outreach workers made an appointment to meet with Grace in the community. And during this prevention visit, Grace disclosed to our ARISE staff that she has a bad relationship with her father and her mother lives in China. She acknowledged that her self-harm behaviors were due to the family stressors. And it was exacerbated during the pandemic because she had to be at home all the time. So she ended up agreeing to meet with our mental health specialists for ongoing individual prevention counseling via telehealth. Grace also provided consent for our ARISE staff to meet with her father and her grandparents. And the family was very willing to meet with our staff because we were able to provide culturally sensitive services to them, and also it was within their language. So our staff went to the home and met outside, and they were able to talk about some positive parenting skills as well as other ways to improve the communication with their daughter at home. This had helped also promote a positive living environment for everyone. The other service we had encouraged Grace to join was our ongoing newcomer support group. So they would meet each week at a local park and everyone was having distance. After attending the group and prevention counseling for a few months, Grace reported to our mental health specialist that she felt her self-esteem and confidence were improving. The other service that we were able to provide was our outreach worker connected Grace to resources. Since she's a newcomer student and her family were immigrants, they didn't know the process of applying for colleges. So our outreach worker was able to connect her to financial aid through the colleges that she was applying to, as well as learning about the application process. And finally, towards the end of the school year, Grace had been able to achieve her wellness goals. Both her and her family expressed gratitude to ARISE and our services for helping not only improve her academics, but also the family relationships and Grace's self-esteem. She was also excited to inform our ARISE staff that she was accepted to UC Davis for this fall. So, our client Grace is a great example of how we provided services in the past school year during distance learning. And as we transition back to in-person learning, most of our ARISE services will be similar. We'll continue to collaborate with the school staff, which we were doing during distance learning on a regular basis. And they had continued to provide referrals to us. And the difference now will be on campus, still getting referrals, but we'll also be having support groups on campus now. And the students that we worked with at our local schools have reported they're excited to return to school because the distance learning had been really difficult for many of them. One of the reasons was because of not being able to focus as much. They got distracted. So they feel that being in person will help improve their focus in learning. And it'll also help improve their mental health since they'll be able to be around their peers again. A lot of them had reported feelings of loneliness during the online learning. The schools have also set COVID protocols, making sure that all students are wearing masks at all times. And the students that we've talked to have stated they haven't felt any kind of worry about that because everyone pretty much does follow the protocols at their schools here. I guess the biggest concern that we have is the college age youth or anyone over than 18. In this past year, we haven't received any referrals from the local community colleges here. And one of the biggest reasons is counselors, they didn't have that interaction before in person. So a lot of it depended on students needing to take that initiative and do their own research to find mental health resources. And it's mostly been a challenge outreaching to this group during this past year compared to the middle school and high school, because middle school, high school staff usually have more hands-on approach, and the teachers as well. The teachers are the ones, if they notice something going on with students, they alert the counselors who then get us involved to reach out to the families and the students. So hopefully with coming back to in person at the colleges, we can reconnect with college counselors and resume the in-person presentations and workshops from ARISE. And for those who don't attend college, the way we outreach is through our digital ads. We also post flyers at local Asian stores and through our community events. All right, next. Okay. So to sum up, our ARISE program has found that working with culture and languages are really important in bringing families together and very healing for our clients. As I stated earlier, it's not just the kids that we work with, 25 and younger, we also can work with the adults and the elderly, and working all together with, I feel in the East Asian culture and community, we all respect our elders. And so having that sort of sense of family and community has been really healing for all of our clients. Thank you for everyone. That's the end of my presentation.
Thank you so much, Marjorie, for sharing the work at Bay Area Community Health. I know it's a great example for offering, holistic in language, also culturally understanding, and just general extensive support to Asian youth, young adults, including their families as well. So similar to the previous presentation, right now we're going to go ahead and move on to a Q&A portion. So at the moment, please feel free to enter your questions into the Q&A box, and Marjorie will try her best to answer them right now. I'll give you a minute or so to go ahead and do that. I suppose I can just go ahead and start off and ask a question, though. Marjorie specific, as we are emphasizing, the importance of family involved in that. Do you see that you offer extensive group therapy in which you try to manage at least the youth being involved with, let's say, their elderly grandparents or their parents as well being involved in these group sessions?
With the support groups, we usually separate the youth and the elderly. The way that we bring them together is through our workshops. So a lot of our parenting workshops, the youth can come as well to hear. And we've received a lot of positive feedback from parents. A lot of times, being new immigrants, they aren't sure the system and the schools, and that's usually what we draw them in. We focus our flyers about academics, right? We don't use words like anxiety, depression. We focus on how to help your students sleep better, how to help your students succeed in school. And that draws them in. And usually that has gone very well for them.
That's great to hear. Thank you for clarifying that for me. At first, I wasn't too certain as well. So I also received another question. And so for that, can you share any specific examples of how centering culture, as we see culture as healing, can help make mental health services more approachable, specific to a lot of East Asian cultures?
Yeah, definitely. So I was saying earlier about our community events. A lot of them are focused around culture. For example, in this last year, we had the Mid-Autumn Festival, we had the Lunar New Year Festival, Dragon Boat Festival. And part of the community event, we bring together our, I guess the presenters would be elderly and youth. And so they would tell the traditions about each of these festivals that we have every year. And it has been really helpful for especially the youth who may not be aware. So hearing the stories from the elderly helps them feel more connected to their culture. And having that connection to culture does bring a sense of improving their self-identity. Because especially with students and youth who are born here, there is some sort of a disconnect for them, either because of the culture and the language. So being able to connect that part of their identity really gives them a sense of better well-being. I hope that answers your question.
I believe it does, especially drawing from, specific examples with the festivals and really hammering in the idea of, integrating your identity as a means for, feeling more connected to your culture. So thank you so much for that answer, Marjorie. Mm-hmm. I see another question. I know it's asking, how has the ARISE program been able to bridge patients to the rest of the BOC health services? How do you connect ARISE's program with just general other referrals and everything?
Other services, yeah. So if we have a student coming in and they need help with dental, vision, and they don't know about the services, then our outreach workers informs them about all the resources that either BOC has or If BACH doesn't have them, then we refer them to other agencies. So a lot of it is the outreach work and connecting them. And we always follow up, making sure that they are linked, successfully linked to those resources. We also provide a role as far as language. If the client doesn't speak English, we help with the translation interpretations.
Thank you for offering that response. That makes sense as well. And I also noticed there's one more question in the chat right now. We see, what are some challenges you've experienced in working with youth and their families? Let's say whether that be in language, I know as you're speaking about, or being recent immigrants in the country, and how have you addressed those challenges?
Yeah. So a lot of those challenges is, like I was mentioning earlier, is if the student was born here, more acculturated, I guess, Western Americanized, and the parents not understanding that, trying to provide the education mostly to the parents, and then bringing them together to meet as a family unit to work it out. It's kind of like a mediation, I say.
Thank you for that response, Marjorie. Okay, that's great. And so
yeah, I wanted to add to that. The other piece is, I know the schooling, a lot of times, like I was saying earlier, the families focus so much on academics. So just providing the education to them about mental health and how if your child is stressed, not sleeping, it will affect their academics. So that helps them focus on the mental health for their student as well. And we also have mental health consultations with our the school staff. What that means is we provide them more education and background about the East Asian population and how the family units work in our cultures.
That's a great response. And thank you, Marjorie, for rooting that, of course, in the academic aspect of that. So thank you, of course, for your insightful responses. Right now, we're going to go ahead and end the Q&A portion for this section, and we're going to move on into the resources and other concluding facts. And we will go ahead and link information, of course, to both of our presenters, links and other information. So thank you for that.
Thank you, Tiffany. Thank you, Marjorie. And thank you to all the speakers. Actually, Megan, I have a question for you before I go into the resources. What did I ask? I was curious if the youth that you had surveyed, what information or like what of those experiences did their parents or caregivers know, or educators? Like, were they sharing it to the adults around them?
Do you mean the interviews that were being conducted?
Yeah, or any kind of feedback about their experiences? Yeah.
So yeah, these were all youth-led interviews, and we went around and asked people around us these questions. And so everything, like Chrissy said, everything we do in this youth campaign is student-led, because that tends to connect better and more deeper with the youths that we interview. And personally, for me, what I found when I was interviewing my peers was that it didn't really feel like an interview at times. It was more like a conversation about mental health, about what was going on in the world. And so at times it was just sharing of ideas and thoughts. And I really, really liked having that space to do it.
Great. Thank you, Megan. All right, that is a great segue past our questions. So we also wanted to make sure that you had mental health resources that were specifically targeted for students, either for them to read or for you to share. If you're working at a community health center or another community-based organization, if you want to share these resources, we have some on this list. We're not going to go through all of them, but of course, we're going to send out this slide deck and also the recording to you all. So these are some resources that we've gathered for students and Asian American students as well. And these are mental health resources specifically targeting or speaking to parents, educators, and clinicians. Again, same kind of focus, Asian American youth, especially given what's going on with COVID-19, et cetera. So wanted to make sure that you have this, and this will be in your packet when we email out the recording as well. And so for this this slide, in 2021, earlier this year, the Kaiser Family Foundation and AAPCHO, we developed and fielded a survey on over 1,000 Asian patients at 4 of the AAPCHO community health centers to focus on recent experiences with racism and discrimination, immigration-related fears, and impacts of the COVID-19 pandemic. And the respondents were 18 years old and older, largely low income, and 80% were born out of the United States. So we wanted to share this survey with you because the results reflect an older Asian American population, but as you can see from the infographic, that there is a very similar spotlight on the need for mental health support. Just a reminder that there are many health center related resources and training events that are available through HRSA's clearinghouse and their COVID-19 FAQ page. AAPCHO, we are also a strategic partner for the Morehouse School of Medicine's National COVID-19 Resiliency Network, which is here. This is their web page, and this is their multilingual helpline. The NCERN page and iPhone app provide location-based recommendations on where community members can get a COVID-19 test, get a COVID-19 vaccine, and find local organizations for other support. And as I mentioned, they also have a multilingual helpline in case folks are not have limited access to internet. And of course, this is our COVID-19 resource hub, apcho.org/COVID-19. We've been gathering these resources since the pandemic and updating it regularly. So we have resources for health centers, the COVID-19 vaccine. We definitely want to highlight the in-language materials because we know that is a big need in many of our communities, and it's often difficult to find that information. So we've been fortunate to be able to gather some resources from many different partners. Also, we have resources to address anti-Asian racism, which includes Stop API Hate's reporting page, and then we'll also be adding the resources regarding mental health, and there are other resources as well. Just want to please remind you to fill out this post-webinar survey. It's really important for us to learn more about your reactions and the impact on this webinar on you, and so that we can continue to better our training and technical assistance providings for you all. And then that link is in the chat as well. Thank you, Joe. And of course, just a thank you. Thank you to everyone. Thank you to our wonderful speakers, Marjorie, Christy, and Megan. Thank you to Tiffany and the rest of our AAPCHO staff that have been working behind the scenes throughout this webinar. And of course, thank you all for participating today. Please keep in touch and contact us with any questions or additional training or technical assistance needs. And with that, we are on time and ending our webinar. Thank you again. Take care, everybody.